Hello, fabulous viewers. Today, we're embarking on a journey that goes beyond the pearly whites, unveiling the remarkable connection between your oral health and your overall well-being. It's not just about a dazzling smile, it's about unlocking the power of oral health for a healthier, happier you. Get ready to discover the secrets that your mouth holds and the surprising ways it influences your entire body. Watch this video to the end. We'll discuss how oral health is related to chronic disease, and how can you prevent these diseases. Did you know that your mouth is like a portal to the health of your entire body? It's not just about brushing and flossing. Your oral health is intricately linked to your overall well-being in ways that might just astonish you. In our quest for understanding, we find that poor oral health isn't just about cavities and gum disease. There's a fascinating oral systemic connection that can impact your heart, your immune system, and even your mental health. Join us as we explore the surprising links that tie your mouth to the rest of your body. Enter Dr. Brittany Seymour from the Harvard School of Dental Medicine, who reveals that approximately 300 diseases and conditions have connections to oral health. Yes, you heard that right, 300. The heart, in particular, takes center stage with recent research suggesting a correlation between inadequate oral health and an increased likelihood of heart attacks. The evidence is so compelling that individuals who experienced heart attacks without dental care had longer hospital stays. And if you're managing diabetes, you're in for some eye-opening insights. A 2020 study found that addressing periodontitis, severe inflammation of the gums, could potentially reduce complications in individuals with diabetes by a staggering 20%. The connection is clear. Your oral health can significantly impact your overall health. But it's not all doom and gloom. Maintaining good oral health isn't just about avoiding the negatives. Research suggests that a healthy mouth can positively influence your cardiovascular system, immune system, and even your mental well-being. So, a dazzling smile is not just a confidence booster, it's a reflection of a healthier you. Practical tips for optimal oral health. Now that we understand the profound connection, let's dive into practical tips to keep your mouth and body in sync. Remember, brushing harder or longer doesn't necessarily equate to better results. It's all about technique. 2 minutes of effective brushing is as good as 5. And don't forget to consult your dentist for optimal brushing techniques tailored to your needs. While flossing might not be everyone's favorite, it's non-negotiable for optimal oral health. Explore alternatives like floss picks or oral irrigators to make the process more enjoyable. Skipping this step can lead to inflamed gums and cavities, so keep those pearly whites in check. And guess what? Your dental checkups aren't just about teeth and gums, they're a screening for signs of cancer too. Dentists are trained to identify head and neck cancers during routine checkups, emphasizing the importance of regular dental visits. For our expecting mothers out there, the myth about avoiding dental care during pregnancy is debunked. Preventive care can address issues before they escalate, ensuring a healthy smile during and after pregnancy. Menopause also brings changes, with decreased estrogen impacting saliva production. Combat dry mouth with sugar-free gum, but remember, it's not a substitute for regular brushing. Selection of oral care products. Selecting oral care products in today's market can be overwhelming, with an array of choices promising various benefits. The oral care industry, valued at $49 billion, is projected to nearly double in size by 2030, offering a wide range of products to consumers. Dr. Brittany Seymour acknowledges that the abundance of options can lead to confusion and uncertainty among consumers. she points out that while these products make enticing claims, it's important to approach them with a degree of skepticism. For example, the effectiveness of plaque removal typically requires a mechanical process like brushing or flossing. Thus, a mouthwash marketed as a plaque remover may kill bacteria but may not necessarily remove debris. Similarly, toothpaste marketed for gum repair, aimed at reducing inflammation and bleeding associated with gingivitis, often contains stannous fluoride, an antibacterial agent, which is also found in many regular toothpastes. Therefore, gum repair toothpaste may not deliver significantly different results compared to other toothpastes with the same fluoride. To navigate this sea of choices, Dr. Seymour recommends looking for the American Dental Association (ADA) seal of acceptance on product packaging. This seal indicates that a team of dentists independently evaluated the product and confirmed that it does what it claims to do. Ultimately, Dr. Seymour emphasizes that she cannot discern a substantial difference in patients' oral health based on the specific products they use. What's more crucial is establishing and maintaining a consistent oral care routine. The key is to find products that work for you and support your commitment to good oral hygiene habits. The variety of options available can be beneficial in allowing individuals to experiment and discover what suits their needs and preferences. There you have it, the incredible link between your mouth and your body health. It's time to prioritize your oral well-being for a healthier, happier you. If you found this video insightful, don't forget to hit that like button, subscribe for more eye-opening content, and share it with your friends. Together, let's spread the word about the power of a healthy smile and its impact on the entire body.